Okay, so we have just gotten some new orders from the doctor for patient Pat Smith, and it is for Cardizem, an IV dose stat, and also for a IV infusion. So I'm going to go to my med room and get my medication. I'm going to wash my hands here, and then I'm going to get the Cardizem. And the first one I'm going to do is the IV stat dose. So I'm going to find my vial, and it is Cardizem 25 milligrams per 5 mils. And that is what I need. I'm going to be giving her 5 mils because our order calls for 0.25 milligrams per kilogram, and after doing the math, it looks like she needs 25 milligrams. So I'm going to take this along with my syringe, and I'm going to go back to my nurse's station. So I have the right medication, right dose, right route, and right time. So I'm going to go back to my nurse's station. And now I am going to look in my IV drug book, and I'm just going to confirm that this medication is compatible with the primary infusion that is running in the patient's room. And right now she has normal saline running. So I'm going to look in here, and it looks like it can be given undiluted through the Y tube with normal saline. So we'll go ahead and do that after I draw it up here. So I'm just going to look again at my medication. I have Cardizem 25 milligrams per 5 mils, and this is for IV injection. It's not expired. It is for the correct patient and at the correct time. So I'm going to go ahead and clean my vial. Wash my hands. And now I'm going to drop 5 mL. Okay, and I'm also going to make a label for my medication here. Cardizem, 25 milligrams per mil, and it is 225. And then I'll also initial it. Okay, so I'm going to go ahead and put this on my syringe. Once I get this ready, I'm going to go find a second RN just to verify the dosage before I go into the patient's room. So Nurse Kathy, could I have you take a look at my syringe, just verify the dosage, and here is the patient's MAR.
Okay. Cardizem, 25 milligrams per milliliter. Okie dokie.
Okay, thank you. And then I'm also going to need you in a few minutes to check the patient's pump after I give this, okay?
Okay.
Thank you. All right, so now I am going to go into the patient's room, and we're going to give this IV stat dose through his IV. So we'll go and see Mrs. Smith. Hi, Mrs. Smith. My name is Elise, and I'm going to be your nurse for this shift, and I just have a medication here called Cardizem. This medication is going to help maintain the reduction in your heart rate, and it's used for patients with atrial fibrillation, which is why you're in the hospital right now. Before I do anything, I'm going to check your wristband, just make sure everything looks correct. So can you tell me your name? And then your birthday is, okay, December 16th, thank you. And before I also do that, I'm going to check your vitals. I'm going to check your apical pulse and make sure that it's not less than 50. And then I would also check her blood pressure and make sure that she's monitored by the EKG. So it looks like she has all of her EKG wires connected correctly. So I am going to also verify that the medication hanging is normal saline, and it looks like it is, and it is flowing at 125 milliliters per hour. So I'm going to wash my hands, and I'm going to verify that this is the correct medication. The Cardizem 25 milligrams per 5 mils. And it's for the right patient, I'm giving it at the right time, and it is the right route. And Mrs. Smith, if at any time when I'm giving you this medication or afterwards you start to feel any chest pain, dizziness, shortness of breath, or dry mouth, please let me know right away, because it could be a sign of a reaction to the medication. So I'm going to go ahead and find the Y port, and I'm going to clean the hub for at least 15 seconds. Contaminating, I'm going to connect it to the Y port. And then this medication I'm going to administer 2.5 mils per minute for 2 minutes. So I would go ahead and infuse that. And after those 2 minutes, I would go ahead and disconnect it. And then again, Mrs. Smith, if you have any of those symptoms, the shortness of breath, chest pain, dizziness, or dry mouth, please let me know. And also, here's your call light, and I will be back in just a few minutes to check on you, and also I will be hanging a bag of this Cardizem. So if you need anything in the meantime, feel free to use your call light. Okay, so now I'm back in the nurse's station, and it is time for me to prepare the IV infusion of the Cardizem, so I'm going to go back to my medication room and get that. Okay, so before I do that, I'm going to wash my hands here. And I have found the Cardizem for the IV infusion, and I'm going to check that it's the right dose. I have 125 milligrams per 125 milliliters, so that is correct. And then I'm going to check my rates, the right patient, right dose, right time, and right route. So I'm going to take this and I'm going to go back to the nurse's station. And I'm back at the nurse's station. I'm going to make sure that, this is when I would probably spike my bag. I would get everything prepared. And then I would also check again to see that I have the right medication for the right patient at the right time and the right route. Also probably inspect the bag, make sure there's nothing floating in there. So now I'm going to find my second RN so that she can come into the room with me and check this before I start the infusion on the patient. So, and then we do have the right medication here. Right, so we will go to the patient's room. Hi, Mrs. Smith. It's Elise again, your nurse. I'm just here to hang the bag of Cardizem that we had just talked about a few minutes ago. Are you feeling okay after the IV push that I just did? Okay, good. You're not having any shortness of breath or chest pain? Okay, great. Thank you. Okay, so before I go and hang anything, I'm going to wash my hands, and I'm going to check that I have Cardizem 125 milligrams per 125 mils, and I had already previously checked that this was compatible with the normal saline, so I'm okay to hang it. And I calculated the rate for this. The order called for 0.25 milligrams per kilogram, IV infusion at 10 milligrams per hour. So we will be administering this at 10 mils per hour. Okay, so I've washed my hands, and I'm going to go ahead and get ready to hang this bag. Okay, so I've got my tube clamped here, and tube is clamped, and I'm going to clean my hub. So I'm going to clean my hub here for at least 15 seconds. And now I am going to connect this without contaminating. Okay, so I've got it connected, and I'm going to set up for line B. Okay, so I'm going to select line B, and I'm going to change mode to concurrent, and we are going to be infusing 10 mils per hour. Okay, so before I go ahead and start this medication, I'm going to have my second RN check this and make sure that it looks correct. So I'll have Kathy look at it.
Yeah.
Here's the patient's MAR.
Cardizem. 10 milliliters per hour. And you have the name on there. Perfect.
Okay, so I've had my second RN check this. I'm also going to double check the wristband before I start anything, and I have Pat Smith. Date of birth is December 16th. And again, Mrs. Smith, if you have any of the symptoms such as chest pain, dizziness, shortness of breath, or dry mouth, please use your call light and let us know right away. It probably wouldn't hurt to check her apical pulse and also her blood pressure. Again, double check that her EKG is set up correctly. So since I've done that, I'm going to go ahead and start my Cardizem infusion. So I go ahead and press start. And then I'm also going to go ahead and lock the pump. And make sure that my line B is open to infusion. Okay, so I've got that locked. Okay, Mrs. Smith, if there's anything else that you need or you start feeling any of those symptoms, please use your call light and we'll come in to assist you. I'm going to wash my hands and exit the room.